Okay. Well, good afternoon, everyone, and welcome to Gray Anatomy. We have Dr. Tony Pittman with us today, and we're going to talk about preventing stroke. And I am going to introduce to you Allison Kuhn, who is the one that finds all these wonderful doctors and practitioners to speak with us, and she will tell you something about the program. And we're off to the races. So thanks, Allison, and thanks, Dr. Pittman, for being here.
Yes,
Absolutely.
thank you so very much. We always appreciate anything that we can do with Lawrence Public Library. Wonderful partners. So thank you for being with us today. I did want to tell you just a couple of things that we do have coming up at the hospital. So on May 23rd, we have a training called Stop the Bleed, and that's a free training. It's kind of over the lunch hour from like 11 to 1, and you can come in and do that training. And it's just to help people realize maybe when an injury is a little more severe and needs some attention before you can maybe get to a hospital and get that advanced care. But that's a really great training that's free, and that information is on our website. Also wanted to let you know about a grandparent class that we have coming up on May 7th, and we actually offer that every other month. So if that's something you're interested in, we discuss a variety of topics: home safety, car seats, safe sleep, and kind of relationships with parents, grandparents, and grandchildren. So just wanted to let you know a few things that we have coming up. And then next month, if you're interested in joining us again, we have a physical therapist, Tess Zayad, who's going to come and speak on functional fitness and things that you can do to stay active. So we hope we will get to see you again in May. And with that, I'm going to go ahead and turn it over to Dr. Pittman, and I'll let you introduce yourself.
Sure. Thank you. Thanks for the opportunity to come speak to you guys this afternoon. So again, my name's Tony Pittman. I'm an emergency physician by training, but serve as the medical director of our stroke program at LMH. So we're going to talk a little bit about stroke today, kind of what stroke is and things we can do to prevent it. Just a little information for you on LMH. So we are actually a primary stroke center. We're certified by the Joint Commission of Health. And then we work closely with area comprehensive stroke centers, primarily the University of Kansas. We have a good working relationship with them, utilize them for some of our treatment modalities that we don't have here, but we are a certified stroke program here in Lawrence. So we'll go ahead and get started here, and we'll have time for questions afterward, but certainly if you have anything that you need clarification on or questions while I move through this, please don't hesitate to ask. So just briefly, so we'll start, stroke. What is stroke, right? It is a disease of the human brain. So the brain is the central organ of our nervous system. It controls basically everything about us, but motor and sensory functions. It helps us receive and interpret information from your senses. So your eyes, ears, nose, etc. It helps us think, it remembers, we understand, we can plan, reason, problem solve, essentially really makes up who we are. Despite its small size, it's definitely one of the most complex organs in our body, made up of millions of neurons. Very vulnerable brain, and the young people basically reaches its maximum size by 18 years of age, but we're constantly able to assimilate new information, learn, change, allows us to experience new things and challenges. So what is stroke? So stroke is a disease of the arteries of the brain. So stroke can occur in two ways. It can occur when there is a blood vessel that's blocked, or it can occur when a blood vessel ruptures or bursts. So the affected portion of the brain basically is starved of oxygen, and it doesn't get the nutrients it needs. And so then it causes those cells within our brain to die. So brain injury from stroke can affect many things. It depends on what part of your brain is affected by what artery. So it can affect our ability to move, to feel, to think. Sometimes, depending on what part, it can affect our behavior, our vision, our balance. So all sorts of things. Definitely definitely important to take away that stroke is a medical emergency. It's a time-sensitive diagnosis. The treatment that we can provide is very dependent on the onset of symptoms. So it's very important to receive medical care as soon as symptoms develop. So you may minimize, the long-term effects, and then ultimately also prevent death. So the way I like to think about stroke is everybody I feel like is pretty well versed on heart attack and the importance of that. And I would say think of stroke as a brain attack. So it's just as important to be evaluated very quickly when symptoms develop. So although stroke is more common after age 55, it can happen at any time in life. I think my youngest patient ever was 16. So it definitely can occur on the time span of life. It is the leading cause of adult disability. So some people who have a stroke can and will make a full recovery. Usually more than 2/3 have some sort of disability, just depending on, again, what part of the brain is affected. So it's a very common thing. Every 40 seconds, someone in the US has a stroke, and 2 million brain cells die every minute during a stroke. So just really, really important to seek medical attention when you notice symptoms. So how common is a stroke? So it has a large impact on society with more than 9 million stroke survivors in the US. About every year, 800,000 people have a stroke, with just under 200,000. Sorry, I'm going to go off screen for a second. Shutting my other office door. So just around 200,000 are recurrent strokes. It's the 5th leading cause of death in the US and the 3rd leading cause of death for women. Women are often about 45,000 more women are affected than men each year. Something that's important is social determinants of health, and Black people are twice as likely as white people to have a stroke. And treatment may reduce the effects of stroke. So again, it's very important for us to see you as quickly as possible. And something that's very important when you present to the emergency department is to be able to provide the exact timing of onset of symptoms. Something we'll talk about in a little more detail later is the things that we can do for stroke. And about 80% of strokes may be prevented with lifestyle changes. So I want to talk a little bit on the types of stroke. So we talked about how stroke can be caused from a blockage of a blood vessel or a blood vessel that bursts. So our medical terminology for when a blood vessel is blocked is called an ischemic stroke. So it is the most common type of stroke, accounting for about 87%. It essentially, again, occurs when a clot blocks the vessel that is supplying blood to the brain. It becomes narrow or clogged, and then essentially it starves your brain tissue of oxygen. So a hemorrhagic stroke, or when those arteries burst, is called a hemorrhagic stroke, or what some people may refer to as a brain bleed. Different areas within the brain that can bleed, different types of bleeding, but basically it happens again when a blood vessel ruptures. It can affect the large arteries, it can affect the small blood vessels, and then essentially it keeps the surrounding area of the brain from getting oxygen. Again, they're less common than ischemic strokes, representing about 13% of strokes, but oftentimes associated with a higher risk of death for sure. So transient ischemic attack is what a lot of people refer to as mini strokes. So essentially, this is the same symptoms that you get with another type of stroke, but usually they resolve relatively quickly. I think the take-home message on this is, even though you may develop symptoms that sound concerning for a stroke, and if you get better, it's still important for you to come see us in the emergency department, because a TIA, although doesn't cause permanent damage, it may be an indication or a signal that you are at a greater risk of a full-blown stroke that may occur in your future. Often it can make the diagnosis challenging, but again, certainly important to come in and see us. So what you can expect when you come in is basically we assess for your symptoms, your medical history. We do a CT scan of your head, oftentimes imaging of your blood vessels, either with a CTA or an MRI, and then plus minus an MRI as well. Once a TIA is diagnosed, really important for follow-up, just to continue to assess your further risk of stroke. So we talked about what stroke is, and so how do you know if you're having one? So the American Heart Association or American Stroke Association puts together something called FAST. And the way to remember that is face, arm, speech, and time. So face, does one side of the face droop or is it numb? You can ask yourself, you can either smile in the mirror or ask somebody to smile and see if their smile looks even. Arms, is one arm weak or numb? Basically, you can have the person lift both of their arms, and does one seem to drift downward? Although we use A for arms, the same thing would be true of a leg. Speech, ask the person to repeat a simple phrase. Can you understand them? Does it sound slurred? Do they seem to have what we describe as what we would say word salad? So they try to answer you and their speech is maybe clear, but the sentence that they're putting together doesn't make any sense. And then to remember time, again, this is just to remember the importance of stroke, and it is a timely diagnosis. So if you observe any of these symptoms, call 911 immediately. Other symptoms of stroke would be numbness or weakness, I would say. So like I said, it could be the arm, it could be the leg, it could be your face, usually located on one side of the body or the other. Confusion, particularly if they're trouble speaking or if they're not understanding speech, if they seem to be talking and they're not making sense. Trouble seeing in one or both eyes. I would say this would be particularly true of loss of vision. So if you have a visual field loss, or if you're seeing double, those would be concerning symptoms of possible stroke. Trouble walking, like feeling unbalanced, uncoordinated, feeling like you're having to hold on to things when you're walking, also concern for stroke. And then more indicative of the hemorrhagic form of stroke would be a severe headache, particularly if this headache starts suddenly and there's no known cause. That could be a concerning sign as well. So if you experience one or more of these symptoms, what you should do. So we talked about previously that you should call 911 or get to the emergency department immediately. Our treatment options are highly dependent on the timing of stroke. We can give a medication called a thrombolytic, which a lot of people refer to as the clot busting medication, but we only have a certain time frame which is safe to give you that medication. So again, super important to come in right away and to be able, if you are able to, be able to provide us with the information of the onset of symptoms. Again, what you can use to learn to recognize stroke would be that FAST mnemonic. So face, arm, speech, and time. But remember, it's other things too: loss of vision, double vision, severe headache, trouble walking, trouble talking. All of those things would be reason to be evaluated. So what to expect when you come into the emergency department. So the number one and most important thing that we do is to do a head CT. And so that helps us determine if there's evidence of bleeding. When you come in with symptoms, even if you're actively having an ischemic stroke or the stroke where you don't have the appropriate amount of blood flow to your brain, your head CT oftentimes will be normal. We do this to ensure that you're not having a bleeding stroke. If you're within the time frame of treatment and we feel like you're a safe candidate, then we would oftentimes administer that clot busting medication. The next thing you would happen is we would do further imaging. We essentially use CT scan to actually look at the blood vessels of your neck and your head, see if there's any blockages. Sometimes large blockages of these arteries, they can be removed. And those are the times that we really lean on our colleagues at the Comprehensive Stroke Center, because they have doctors there that can actually go in and remove these clots. And then oftentimes during your hospital stay, you'll have an MRI. Oftentimes you have an echocardiogram, which is an ultrasound of your heart. So that's kind of what to expect. It's a lot of action when somebody comes in as a stroke alert. A lot of people in the room. We try to get you to the CT scanner very quickly and have those results back so we can get that medication to you as fast as possible. I saw there's something in the chat. Is there a question or?
There was the first question that I was reading. Was it good practice to give the person with those symptoms an aspirin as soon as
Yeah.
possible?
I think it's a hard question to answer. 87% of the time it would be yes. The only thing we would want to avoid is giving somebody an aspirin if they actually are having bleeding in their brain. So I think we have time to administer that to them. I think most importantly is getting them to somewhere where we can evaluate them.
Okay.
And then the next question looked like, what is the time limit for administering the clot busting drug? So if we're giving that to you, ideally 3 hours, but we can treat you up to 4.5 hours. So there is some time frame. There is a little bit of wiggle room depending on onset of symptoms and some CT results, but I would say 4.5 hours is usually the hard stop before we don't feel that medication is safe. And the reason that is that it does carry a risk of bleeding, and we don't want to delay that too much or we increase the risk. So effects of stroke. So you've noticed the stroke, you've come to the hospital, we've diagnosed you with the stroke. So what are the effects? So how that really is it's basically the region of the brain that is affected. It's the size of the area that is affected. And then depending on where it is in the brain, certain parts of the brain control certain parts of the body. And so the person's functionality will really depend on the part of the brain that was affected. So a stroke on the left side of the brain essentially controls the right side of the body. Oftentimes, this is where our speech hemisphere is located as well. So a left side stroke can result in weakness and loss of sensation on the right side of the brain. Can cause speech or language difficulties. So again, speech, like slurred speech, or also the ability to understand speech or communicate. Inability to read, write, and really process and learn new information can oftentimes kind of cause a slow, kind of cautious behavioral style, reduces your ability to do math, reasoning, analyzing things. So really kind of motor, scientific functions, that sort of thing, and also some memory loss. So a right-sided stroke, kind of just the opposite, will affect the left side of your body. So you can have weakness and loss of sensation on the left side of your body, affect depth perception or directions. This is more the artistic half of your brain. So art awareness, creativity, inability to recognize emotions. And then again, as well, memory loss as well. So what can you do to prevent stroke? So there are some risk factors that cannot be controlled, right? So age, obviously it can occur, even though it occurs at any age, risk increases after the age of 55. Family history, stroke appears to have a genetic leak. So if you have somebody in your family who has had a history of stroke, it puts you at a greater risk. Again, like I said earlier, race and ethnicity, certain races have a higher prevalence of stroke than others. Gender, women have a lower risk than men before menopause, but then actually have a higher mortality risk of stroke. And then if you have had a prior stroke or a TIA, that puts you at an increased risk of stroke. So a person who's had a TIA has had 1 in 3 more likelihood of having a stroke. So remember, we talked about earlier that TIA is that mini stroke. And even though those symptoms are resolve, it's super important to still get evaluated because it gives you a 1 in 3 more likelihood of actually having a future stroke. And so what's important in those cases is we want to treat all the modifiable risk factors that we can to reduce your risk of having a recurrent stroke. And then again, if you've had a stroke, it means you're at a greater risk for another stroke. So almost 1 in 4 will experience a recurrent stroke in the next 5 years. Medical risk factors include high blood pressure. So measurement of a blood pressure of 120 over 80 and above is considered high blood pressure. So it's important, and here in these instances, it's important for preventative health care and for you to work with your primary health care providers to manage your blood pressure. If you have diabetes, uncontrolled diabetes is a risk factor, uncontrolled cholesterol, atrial fibrillation, that is a risk factor for stroke. Probably some of you suffer from atrial fibrillation, and probably all of you have heard of the commercials about people who are in AFib are on a blood thinner, because the atrial fibrillation, basically you can form clots in your heart that can break off and then cause stroke. So what are the things that we can do to help us prevent stroke? So Not everything is preventable, but there are a lot of things that are. So quit using tobacco and vaping. So smokers have a 2 to 4 time increased risk of a stroke compared to non-smokers or people who have quit smoking 10 years ago. So it's never too late to quit. It's really what I tell my patients. It's one of not that it's easy to quit, but it's a very modifiable risk factor that is very important to your health for stroke and all of your cardiovascular health, so heart and so on and so forth. Limit or reduce alcohol use. So heavy drinking can increase your risk for stroke. No more than 2 drinks a day for men and 1 drink a day for non-pregnant women. Maintain a healthy weight. So, eating right, increasing your physical activity can help reduce your stroke risk. So even a brisk 30-minute walk each day can improve your daily health. Goal would be for about 150 minutes of moderate to vigorous physical activity a week. Diets rich in fruit, vegetables, whole grains, good sources of protein, so lean meats, fishes, beans, and then try to limit salt, added sugars, processed food, and fried foods. So Life's Essential 8, this kind of goes over 8 things that you can do, or a checklist, not just for stroke health, but lifelong good health. Really, this will affect all of your cardiovascular health, lowering the risk for heart disease, stroke, and quite honestly, many other health problems. Again, eat better, whole foods, fruits, vegetables, lean proteins, nuts and seeds are super great. Using oils such as olive oil or canola. Be more active. You should be up getting some moderate to vigorous physical activity, 2.5 hours or 75 minutes at least a week. Quit smoking. So even vaping, and I think we're seeing that, excuse me, in kind of our youth. So important for them to stop this moving forward. Sleep. Most adults need about 7 to 9 hours of sleep each night. And really when we're sleeping, that's when we're promoting our healing. And so it improves our chronic conditions and improves our brain health. So adequate sleep, super important. Managing weight, also important, which goes along with moving more and healthy diet. And then controlling our cholesterol. High levels of LDL, or what we call the bad cholesterol, can lead to heart disease or cardiovascular disease, so increases your risk of stroke. It basically forms plaque within our arteries and builds up and can cause blockages and clots. Manage your blood sugar. So if you're diabetic or if you're pre-diabetic, be aware of what your blood sugar is. Eat in the way that can help manage that blood sugar. And certainly if your doctor has prescribed medications, important for you to take those. And then managing your blood pressure, again, super important to take medications if it has been prescribed by your provider. High blood pressure is really the leading cause of stroke and the most significant controllable risk factor. So important to take those medications. I think sometimes it's hard for us because we don't always feel bad when we have high blood pressure. So people don't tend to take their medications, but certainly puts us at risk of a lot of things. So again, take your medications, reduce stress, get good sleep, increase your physical activity, eat healthy, don't smoke. And then certainly seeing your doctor and talking to them about any risk factors that you may have and what you can do to modify your risk of stroke.
There's a question in the chat box. You mentioned blood pressure recommendation could be different when you're over 65 and
Yeah, and I think that's something to take up with your primary care physician and see really what is a manageable blood pressure for you and your condition.
okay.
Any other questions, either via chat or however else?
Yeah.
Happy to answer anything.
One in the box says, I'm hearing a lot about LDL-C cholesterol. What is that?
So LDL cholesterol is really your bad cholesterol. So that's really the most important piece. And it's important when you get your cholesterol panel, they'll look at both your good cholesterol and your bad cholesterol and what you can do to modify those.
But what is it? Maybe is the question. It's just a marker of,
Yes, yeah.
okay. I've heard that some people have, I've heard the other side, it's the age of what's the truth. But I just discussing things with other adults. My sister who's has dreadfully high blood pressure, and she's always been thin and very active and eats a lot of salad. And the question being, some people just have high cholesterol, and it isn't a bad thing. Is this a story we're telling ourselves, or are these not? I mean,
I think it's still having high cholesterol, particularly if it's the lipoprotein or that bad cholesterol, is never good. I think you have to take into effect the ratio of your good cholesterol and your bad cholesterol and kind of what that means. But I would never say that significantly elevated cholesterol is something you should evaluate and control.
okay. And someone here asks, is it true that stroke can be a higher risk after you've had COVID?
Yes, they have found, I don't think the data is great out there, but they have found that certainly people have a higher risk of cardiovascular complications after having COVID. So I think, as COVID is relatively new, I think studies still to come out and demonstrate as such, but certainly even in just my practice, I would say, COVID has had an increased risk of heart events and stroke events both.
Hmm.
Hey, Laurel, circling back to the LDC cholesterol question,
Mhm.
she's wondering if what is I'm sorry, LDL-C cholesterol. What does
Yes.
the C mean? Did you get
It is again, it's just another nomenclature
okay,
for the low density lipoprotein.
okay.
Okay, there's a question here. Can very high blood pressure, like 200 over 90 or 100, mimic a stroke?
Absolutely. Absolutely. You can have stroke-like symptoms and maybe not have evidence of damage to your brain tissue. And what we would call that would be what we would call a hypertensive emergency. So really managing that blood pressure when it's super high.
Okay, and managing it, does that vary from doctor to doctor? When you're saying ask your doctor and they will help you find a way to manage it, is it always a drug, or are there other things, protocols?
Yeah, in my opinion, I think, the proper management of high blood pressure is both lifestyle modifications and oftentimes medication as well. So all the things that we talked about to help you reduce your risk of stroke, healthy eating, exercise, all of those things are going to naturally help reduce your blood pressure. I think this particular question, though, when we're talking about extremes of blood pressure and can they mimic a stroke, those are the times where we're actually giving you IV medication to lower your blood pressure. We don't always treat elevated blood pressure in the emergency department, but if it is severe enough where you're having stroke-like symptoms that we think are secondary to your blood pressure, then yes, we would treat you with medication in emergent fashion.
Okay. And another question here about taking an aspirin at the onset of a stroke. Is it helpful to do that, or like take one on the way to the hospital, or?
Again, I would say most times that is safe. It's aspirin is a drug that is basically antiplatelet, so it keeps your platelets from sticking. Most of the time it's safe, 87% of the time it's an ischemic stroke. I think really though, the takeaway more than aspirin is getting to a hospital quickly so you can be evaluated to see if you're a candidate for any other intervention.
And I'm wondering myself, since I live 11 miles out of town by myself, is it a good idea for me to get in the car and start making my way to town if I'm having any of those symptoms? Drive myself?
No, I would not recommend you drive yourself, because what if your symptoms would worsen? So I would say always 911 or
Okay.
have somebody drive you faster than what 911 could.
Okay. Here's some question. With AFib, if an ablation has been done successfully, does the stroke risk decrease?
Yes, as long as you're not having episodes of atrial fibrillation, you're not at risk of a clot formation. So if your ablation was successful, yes, your stroke risk definitely decreases.
I was just wondering if I saw somebody having a stroke. And quite honestly, I had a friend here having dinner once, and she had some kind of event. I don't know what it was, and I did call 911, and it did take about
Sure.
almost 25 minutes, but for the person, for them to come here. But the question is, if I'm with someone and they're having some kind of droopiness, what do I do for them
Mhm.
while they're here in my care waiting for somebody to come? Or do I wouldn't know how to, you know, we get them in the car and
Right. Again, I think the most important thing to know is they need to be evaluated by a medical professional or a medical professional as quickly as possible, depending on how you get them there. Something that is, you know, super helpful for us, if something that more than anything you can do, like if you can help that patient, you know, basically, the onset of symptoms, right? And then if that patient has a medication list, maybe help prepare all of that information, because certain medications prevent us from being able to administer certain
right.
treatments. And so I think the most important thing, and you may not be able to do any of this, but is really just having as much data and information possible that you can share. And then I would think, if you're taking somebody to the hospital, making sure that you're available to talk to the provider and the nurses. And so you can provide the history that including onset of symptoms, particularly if you witnessed the symptoms. Super important piece of information for us to know.
Yeah, look at the clock.
Yeah, look at the clock. I think that and medication lists are the two biggest things that we need to know to help us determine treatment modality.
Okay. I'll read this to you. It's another thing in the box, and I think someone's asking for a little advice. I had a successful ablation, but they tried to take me into a Watchman.
Talk you into Watchmen.
Talk you, and yeah,
Yeah,
and what are your thoughts? Talk
yeah,
me into a Watchman. What is
yeah.
that, I guess?
That's hard for me to answer, because your provider may feel like you need one for other reasons. So I would think it's worth having a discussion with them. Ask them, specifically ask them why they think you still have an increased stroke risk. Why do they feel like the Watchman is important for you? You definitely deserve to be educated, but certainly, as I don't know your health history, I don't feel like I can give you an accurate interpretation of that.
Right. Now somebody wants to know, what is a Watchman? I thought
Yeah,
there was somebody up there
it's
on the
basically
turrets.
a device that they can insert. So instead of having people on a blood thinner, it's kind of a mechanical way to prevent blood clots getting to your brain.
Maybe we all need one, just in case.
Any other
Yeah,
questions?
other questions? And if you could feel free to unmute yourself and ask your own question. That way I won't misread your comments. Any other questions? Well, here's somebody trying to come in. I'll let them in.
How hard is it to diagnose? My brother had a stroke, and at least according to him and his wife, they didn't diagnose it quick enough in the hospital, and he didn't get the medicine he needed early enough.
I think that question depends on how a person presents. I will tell you that the types of stroke that can cause symptoms with balance and vision, those can be very challenging and much more difficult to diagnose. So it really depends on the symptoms, if they're, significant and present when somebody presents. And so it can be a challenging diagnosis. Like, stroke is not always, oh, all of a sudden I can't move the side of my face or my arm. It can present with, um, you know, uh, a vast array of symptoms.
Yeah, he'd lost his left side. I mean, pretty quickly. the movement.
Understood. Go ahead.
I said he lost his left side. So is there this medicine that they can give you that dramatically reduces the long-term impacts? I've had other friends who supposedly had it and they
Mhm.
walked away with nothing.
Yeah, again, I think the evidence is not super strong. Like it's not going to definitely take care of all of your symptoms. But is it worth the risk in certain people? Sure. I mean, it carries a risk of bleeding within your brain, about a 6% risk, quite honestly. But I mean, it's the only, it is the only treatment option that we have in some instances. We can extend out, like doing direct clot removal or direct thrombolytics. We can extend the time frame out a little bit. But yeah, it is not a definite, but it's best chance is what I would say. You can receive this would be called TPA or T in case. You can receive those medications and unfortunately still have, you know, deficits from your stroke. It's not 100% curative drug.
There's a
If
kind of a question here in the chat. Weakness in a left arm for a long time and achiness. Is this a precursor to a stroke? Other symptoms aren't clear. I'm not quite sure I asked your question properly, but maybe.
Again, that's hard to answer. If I mean, a weakness could be due to nerves in your neck, nerves in your arms. It could be due to your brain, and so I think it's something, again, worth talking to your primary care physician about. If it's been there for a very long time and you haven't had other symptoms of a stroke, there's a possibility that it's coming from some other etiology.
Mhm. Any other questions?
I see about the aspirin and does it prevent administration of the clot busting drug? Not necessarily. We're still going to give you the medication if you took aspirin.
Mhm.
Things like warfarin, Eliquis, Xarelto, if you're on any of those medications, we cannot give you the clot busting medication.
When I was reading a little before we opened up this afternoon, I was reading that there's an increase of strokes now among younger people, and you did mention that the youngest patient you had with a stroke was, did you say 16? Yeah.
Yeah.
And they're saying that younger people are having them now, and is that kind of in line with what you've noticed in your practice? And why do you think that is the case? If we can even venture a guess.
Yeah. Yeah, I would say, so that like in the very young people, it's usually some other kind of, risk factor that either like a clotting disorder or an injury or something like that. But I think in general, our population has aged prematurely in their health. I mean, we see people in their 30s with heart attacks and unfortunately, I think our lifestyle of today is just promoting a bad milieu for our bodies. And so I think that's probably kind of the easiest answer is we just aren't an active population and we eat a lot of processed foods. And unfortunately, those are the cheap foods. Eating healthy is not always the cheapest option. And so and money is tight up today. It's hard to live. So, if I was to venture a guess, I think that's kind of a big piece of it.
Yeah, and a little bit more sedentary.
Yes, absolutely.
Yeah, 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 I know that's for sure. I'm out here in the country and you know, my old neighbor Frank said, when you sit down, you die.
Yep, I hear you.
So he was always on the move. Um,
Yeah.
oh, here's a couple. Well, somebody asked about warfarin and Eliquis. Are there meds to reverse those so clot busters can be administered?
We do have met. So if you have a hemorrhagic stroke or a bleeding stroke, stroke, we do give you medications to kind of stabilize those medications, but it is not safe to reverse those and then give you a clot busting medication. We would cause you more harm than good. And
Okay.
thank you to Deanna's husband.
Yes, I see.
I
There's a
practice
shout out.
part-time in the vein center as well. So I'm part-time in the emergency department and part-time here in the vein center. So
Mhm.
come see me if you have varicose veins.
Well, there's a testimonial right there, ladies and
That's
gentlemen.
right. That's right.
Any other questions about stroke? I was just wondering, it's such an interesting name. I know I'm a word guy, but what's the derivation of stroke? It's just, there's a stroke in golf, and I stroke my dog's head, and I'm thinking, and then there was a stroke of lightning, mostly
Yeah.
the bolt. But I just wondered how they came up or how that came about to be called a stroke. I suppose we'd have to go back in the annals of medical jargon or something,
Yeah.
but
Yeah, because in our world, it's cerebral vascular accident. So it's a little bit of different verbiage
yeah.
through, medical language. So I don't know. That's an interesting question, like how it was, why don't we call it a brain attack like we call it a heart attack?
Yeah,
I
yeah,
don't know.
that
Yeah,
makes sense. A brain
yeah,
attack.
yeah,
Yeah, that does make a lot of sense. But I suppose it comes in a stroke. I don't know.
yeah.
I
Comes
don't,
fast like a strike of lightning. I don't know.
I don't
I
know.
don't know.
Well,
If
these are
you
the kind of
find
things
out,
I,
please email me and let me know because that's an interesting question.
yes, these are the things I think about when I look out the window in the afternoon at 4 o'clock, I guess, but that's just an interesting concept. A heart attack, a broken leg, those are more specific,
Yeah. I think
but
that's
it's,
what makes stroke difficult is that
yeah.
so many portions of our brain, control different things. And so it's not, you know, always obvious.
Mhm.
Rita had a question about varicose veins. Will they cause stroke? No, varicose veins won't cause stroke, but they cause symptoms of pain, achiness, heaviness, but also can cause damage to your skin and your soft tissues, and then eventually can cause, and some people can cause sores that don't heal. And those are the biggest risk factors of varicose veins, but they are not, in and of themselves a risk factor for stroke.
Okay.
What about like treatment for recovery? I mean, can you speak to that in terms
Yes, that'd be good.
Treatment for recovery of stroke.
of a stroke? Yeah.
Yeah, being that I'm an emergency physician, I really see people on the front end of stroke and not the back end of stroke. It really depends. Sometimes it just takes time and rehabilitation and really the time for the brain tissue to declare if it's going to be recoverable or not. So, the symptoms when you present versus the symptoms at 12 hours, doesn't mean that those are the symptoms that you're going to have long term. So it's just kind of a period of time to see how that brain tissue recovers.
Hmm. Is
Some
there?
people have strokes and don't even know it. Like I've done MRIs on people in the emergency department for other reasons, and we can see that they've had a stroke sometime in the past, but they were completely asymptomatic. So again, it just depends on where in the brain and how much of the brain is affected.
Hmm.
So is there any particular kind of exercise that's better for prevention, like cardio or, weight training? I don't know. It's like what's best exercise wise to try to prevent a stroke?
Yeah, I would say both
Okay.
are best for your health. Weight training will help with bone health. It also helps with really maintaining a healthy weight. Weight training is good for that. Obviously, some cardio activity is good for your cardiovascular health. So ideally, you incorporate both of those into your regimen.
Okay.
Let's see, any other questions? Oh, Paulette's, somebody's here. Hold on a minute.
Who's out there?
It's a lot to take in. The stats that I looked up said it was the third leading cause of death worldwide is stroke, and 15 million strokes per year, and 7 million fatal and 5 million disabled people are
That's
disabled.
a huge disability for people. I mean,
Mhm.
Yeah.
you can have, we use a scale called an NIH stroke scale to kind of give a number to the severity of your stroke. But
Uh-huh.
oftentimes that doesn't mean a whole lot to me because your score could be 1, but you could not be able to talk, right? And so that's very life altering,
Yeah.
So really kind of the way I evaluate people is not really that score, but how is this going to affect their life? Like, is it going to, you could have a score of 1 and have a little bit of numbness in your arm. You can function with that. But, not being able to communicate, that's huge. And so
Mhm.
you have to
That's
really take into effect, how it's going to affect people if they would not make a recovery at all.
right. Shelley asks, are there screening tests for stroke prevention?
I think the main thing is those modifiable risk factors, right? So screening your blood pressure, screening your cholesterol, those making sure you're not diabetic, healthy weight, healthy exercise. Those are the biggest things. With like hearts, we do things like stress tests and things like that. They can do ultrasounds of your carotid arteries just to make sure there's not a large blockage in your arteries, but that doesn't always mean that you're clear. So really the most important takeaway is really modifying those risk factors that you can.
Mhm.
Oh, we have an answer to our stroke question there.
Yes, Jack got out the dictionary.
Awesome.
First used in 1689 to describe severe brain injury, a brain attack, derived
Yeah,
from the term
see?
meaning a sudden blow. Well, I thought about that.
Like that.
I guess that's better than calling it a blow, too. He had
Mhm.
a blow.
Yeah,
What?
yeah.
Okay. Stroke would work. Thanks, Jack.
Thank you for that. Now I know. Hundreds and hundreds of years ago.
I'm so sure that's the last thing anybody would ask.
Yeah.
If I was
Previous
there.
term was apoplexy, and they thought stroke was more appropriate.
Yes.
Oh, interesting.
Interesting.
It's easier to spell.
I like medical history, so that's super interesting.
Easier to spell. Okay. Someone asked about, could you speak to the stroke risk for PFO hole in the heart?
Yeah, so that's basically a hole in your heart. So it increases your risk of stroke because it can allow clot to pass to the other side of your heart and then go to your brain. The exact number of the increased risk, I can't give that to you off the top of my head, but it's something we do screen for, especially in young people. I would say young people who have stroke, we definitely do certain tests to evaluate for a PFO.
Okay. Well, it sounds like we all need to give up salt, eat more lettuce, get off the chairs, run around, get a herd of cows to take care of, like my neighbor Frank,
That's right.
throw a few hay bales around, do wash on a washboard,
I don't know about that. That's a little intense.
walk 2 miles to town to sell the eggs on Sunday night, like a woman named Ruth did in this house. She walked to Lone Star on Saturday night to sell the eggs and walk back. So that's something to be said for that. I think it is good to be active like that.
Mhm.
Yeah, it's good for all sorts of things. Every piece of your body.
Mhm.
So it's good for bone health and heart health and brain health and lung health and gut health and everything.
Let's hear it for all those healths.
That's right.
Uh-oh, my clock is going off. My clock seconds that emotion.
Absolutely.
Okay, there's a new message. I'm going to go down. Oh, if you have a watchman, do you need to be careful?
No,
That's the watchman's job, right?
that's right. Mhm.
Okay. But I think even if you had a watchman, you should get on your bicycle once in a while and go around the block.
Absolutely. Even
Yeah.
if you're on a blood thinner.
Right, and don't stop at Culver's.
That's right. Any other questions?
Yeah, more questions out there?
No, like you've been very thorough.
Yeah. I mean, that's most interesting. I'll just pontificate for a moment. We know what to do. It's just the question is, it, it's a lot of questions, but we all know that we need to be now that we have so many things. I have a vacuum cleaner. I don't have to beat rugs anymore. I don't have to work as physically difficultly hard things that I used to do. I got an electric ice cream maker instead of a hand cranked one. That's how I started. So I've really gone uptown.
That's right.
What, why does why do sleep problems affect the chances of having a stroke? I'm
Yeah,
trying to figure out the,
sleep deprivation is just a risk factor of your health, right? And so if you're chronically sleep deprived, it can increase inflammatory, response, and it affects you as a whole. And so because of that, that's why it increases your risk of a stroke, because you don't have time to heal, right? Your body might be in a chronic inflammatory state. So sleep is super great for restoration and just healing. And that's really where it comes in.
I heard a good phrase for that. Been reading a column by Arnold Schwarzenegger of all people, but he has a app called Pump, and it just tells people how to take care of themselves. And besides eating properly and getting some good exercise, the phrase they used was getting enough sleep was crucial, even
Mm,
more crucial, and drinking enough
absolutely.
water. And they called it sleep hygiene.
Yeah, absolutely.
And
I
I
mean,
thought that was a
most,
really interesting way to think of it. I'm going to
yeah,
bed now. I'm leaving my telephone in the kitchen on the power source. I'm not having any light in the room. I'm not laying in bed watching TV until 3 o'clock in the morning because I'm too tired to turn it off. You're very, very intentional about your bedtime and keep the room dark, cool. Um, no night lights. It's most interesting. I've been trying to improve my sleep hygiene.
yeah, for sure.
Yeah.
I think most studies will show, like, if your choice is sleep versus exercise, is actually it's better for you to sleep. So don't deprive yourself from rest to try to be active. I mean, rest is super important to your wellness as a whole.
Right. This is why I remember back in the day when I had teenagers in the house, they were sleeping all the time.
Mhm.
And that was a good thing.
Yeah, I own some teenagers, so yes, I understand.
Yeah. They should be cleaning the garage with dad at 8 o'clock in the morning on
Yeah,
Saturday. I don't think so. They're growing brain cells and they need some.
absolutely. They do.
So let them sleep.
It helps you more.
Yeah, they'll help you
Dep-
more.
Yeah, sometimes a sleeping teenager is better than a grouchy teenager. So
Darn right.
Yes. Yeah, definitely.
yeah.
Very much so. Does anyone have any more questions? This is such a huge topic, and
Mhm.
it's so much about stroke, yet we don't know. It's a stroke, as Jack so brilliantly pointed out. It comes from nowhere. It's a blow to the head. But it sounds like there's a lot of things in place that should you be experiencing one, there's a lot that's not the end of the world, that things can be done immediately and working through it. medication. Remember, if it's happening to someone in the house with you, look at the clock. Notice
Right.
that
Most important takeaway is timely evaluation. So
timely
get
evaluation.
to a medical provider as quickly as possible.
Okay. We'll do that. Okay, is there any more questions? Okay, let's say. Here's, it says, oh, the end, do you know someone who has survived a stroke? Yes, I do. And I think all of us do, someone
Yeah,
who
for sure.
survived a stroke.
I think it affects everybody.
It sure does. Yeah,
Mhm, mhm.
yeah.
And then the rest of this is just how can you recognize a stroke? We talked about that, right?
Right.
Which medical conditions? We talked about that, about beating our rugs and walking to sell our eggs and all of those things. So small changes, I would say, none of us are going to be perfect in our life. I try to tell people live by the 80-20 rule. 80% of the time you're good, and then 20% you get to do what you want and enjoy life. So you don't have to be perfect, but
Arnold would second that emotion.
yeah. Mm-hmm. You
Okay.
still have to enjoy life a little bit.
You
So
sure do. Yes. What's that thing about that? I've been told that by eating more kale, I've increased my life expectancy 20% and my joy is now down to 0. Something like that. But anyway. And Rita asks, what about looking in a mirror at myself? I'm by myself. Yes, that's probably what you need to do.
absolutely.
Yeah.
Absolutely.
Go smile at yourself in the mirror. You should do that anyway, every day. We should do that just to give each other encouragement to get out there and do our best. Well, I guess we're done. Thank you so much. We've definitely learned a lot, and we appreciate everybody being here today. And we will see you next month. We're going to be talking to someone about functional mobility, where you can, someone with the LMH physical therapy department, and we will be learning how to maybe, have any of you ever worked out with cans of soup because you don't have a 1 pound weight?
Yeah.
So we'll be doing things like that, and we'll be learning how to keep busy. And thank you all for being here today. And thank you again, Dr. Pittman, and thank you again, Allison, for setting us up with all of these great people that keep us. Yes, we'll give you all a hand. Thank you so much.
Yeah.
A lot of
Thank you.
people that have given us a lot of information. And
Thanks for the education about the origin of the word stroke.
yes,
Yeah.
we've all got a
We've all
takeaway today.
learned. We've all learned today.
Okay. All right. Thank you so much. Goodbye, everybody. We'll see you
Thank
next
you.
time.
Mhm.
Bye-bye.